Oh, you're funny.
This is Kay Austen,
You're funny.
and the voice you hear in the background is that of Robin Austen, her older sister and her carer. Kay is disabled with high needs, requiring full-time, around-the-clock care from Robin, who also cares for her elderly father, Kevin.
She requires assistance walking, and if we go to the shops or something, it's a wheelchair now. With the dementia and the Parkinson's, her phobic behaviours have increased, and she's terrified of the car, and it sort of goes in cycles. Sometimes she's not so bad, sometimes she's worse, but so sometimes we haven't been able to get her out of the house at all.
In February, the Productivity Commission released its $6.3 billion plan to overhaul an underfunded and inefficient disability sector. The plan, known as the National Disability Insurance Scheme, will provide around 360,000 Australians with individualised funding.
The current scheme is regarded as underfunded, fragmented, inequitable and broken. The sorts of words that people say.
Associate Commissioner John Walsh from the Productivity Commission played a crucial role in producing the scheme.
We actually think we've got bipartisan support. So we've spoken to both sides of government. Both sides of government have publicly announced that they supported the idea of the scheme. The scheme calls for a big increase in funding, so both sides of politics would be considering carefully what the priorities of funding are.
I don't think the government gives enough assistance. I don't think it gives anywhere near enough assistance. And I think too much of the money that's currently out there to fund disabilities and mental health is going in the wrong area. And I think it's being channelled in the wrong ways.
If this system is adopted by government, what it does is flips the system upside down from where the control is with the government and service providers to where the control is with people with disability. So if people are prepared to take on that challenge and develop support frameworks, and if service providers are prepared to reconsider the way in which they meet people's support needs, well then I think there's a good chance that we can create real change.
Associate Commissioner John Walsh is one of the lucky ones. Despite his disability, he's managed a distinguished corporate career. However, many people with disabilities, and especially those who care for them, haven't been so lucky. They've had to give up full-time careers to become carers. Rob Austen was a television makeup artist. She had to give all that up to become a full-time carer to her sister Kay.
It's really hard because I'm used to working and being self-supporting, and I worked in a really stimulating industry and very, very long hours, so it wasn't compatible at all with being a carer, which is why I made the decision eventually, after years of trying to be superwoman and realising I wasn't, that I just had to surrender to the fact and become a full-time carer.
Carers currently receive precious little respite or funding. Most startling was the fact the report found that carers have the lowest level of well-being of any group in Australia.
All I could think of as I was reading was blah, 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 blah. More words, more ideas, more strategies. We've heard it before. It doesn't work now. I'm going to be interested to see if it does work, and I would love it if it did work. I would really love it. But to be honest, it's more words. I don't want words. I want money, and I want it to come down to the people that need it.
And these people are 24/7 without any respite whatever, and also with the anguish of knowing that if something were to happen to them, there's no one who'd be able to look after their son or their daughter. I mean, this is a national scandal, and it has been for years.
Abdullah Ibrahim was born with Harlequin fetus syndrome, a genetic disorder so rare he is the only Australian with the disability and only one of a handful of Harlequin sufferers in the world.
I think you can never say enough is sort of enough. You can always do more. You can always, create different initiatives and programs to cater for people with different, because at the end of the day, people with disabilities have different disabilities. They have different, it affects them in different ways. So therefore, you've got to be able to cater for that. So I think education is important, educating, people, what these, people in these kind of positions, what these disabilities are and what they entail. Because I felt with with my situation that people often weren't aware of what it actually entailed and what it meant. The government has to train, you know, people in institutions to be aware of what these people need, what's affecting them, how it's affecting them.
Liz Yarker is a carers representative at Carers New South Wales. She is also a full-time carer who fully understands the frustrations of not being able to find respite care that appropriately caters for her husband James.
James has a condition called autoimmune polyendocrinopathy candidiasis ectodermal dystrophy, which is a genetic condition and it affects 2 to 3 in every million people. Basically, it means that James gets autoimmune conditions. The respite, James falls between the gaps. And also, like, we can get some emergency kind of respite. If I have something to go to, we can kind of fill that gap on short term. But those carers can't, you know, give injections or even check levels or anything like that. So basically, James is either, you know, too well to really need the carer or too sick for the carer to actually be any use.
While the NDIS proposes revolutionary fiscal changes to the disability sector, sadly, there is still a long way to go in changing the public's attitude towards those with a disability.
For people like James with a hidden disability, as you know, a lot of people call it, and other people with hidden disabilities, people don't know when they meet them that there's anything wrong. So we don't want to be treated the same, but don't, you know, make allowances for differences.
There are still a very large number of people out there with very severe disabilities who are hidden, who are just in their homes all the time, or are in institutions and are invisible to the public. So to that extent, I think we've still got a long way to go.
Kay and others like her will have to wait until July when the Australian government decides if the recommendations of the Productivity Commission will come to fruition, providing improved assistance to those living with a disability.
Soon you'll see.